Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. Hal Royer. Dr. Royer is a family physician at Brevard Family Practice and regional clinical leader for HCA primary care practices in Brevard, Cashers, Highlands, and Franklin, North Carolina. Welcome to our program today, Dr. Royer.
Thanks, Angela. Glad to be here.
Well, we are excited to listen and learn, and in this day and age of this pandemic, we're all talking about the emphasis put on things like hand washing and wearing of masks. And I understand there are some proper ways to do this to be effective, and there are some not so proper ways. So what can you teach us today?
Well, I don't have anything that's magic today. A lot of what I may talk about today may be obvious to some folks, as my computer acts up. But I think it's worth reinforcing as I work here in the office and I visit with patients, and it's sometimes a little alarming at the way we are using we have limited tools, and the way we're using them may not be the most effective. You know, as you know, the social distancing that we've been doing has made a huge impact, or appears to have made a huge impact, and we haven't gotten nearly the surge that we thought we were going to get. And maybe that's due to a lot of effort from the people of North Carolina with their social distancing and some good leadership through the healthcare system here in Brevard and the Pisgah Health Foundation. And so it feels like a big win, but now we face where do we go from here? And that's something we're all still trying to figure out. And what we do know, although this virus, the numbers have been quite low here, perhaps with some good luck, we know that we have the potential to have it flare up again at some point. And so this virus has not disappeared, and it's going to be around for a long time. And we need to figure out how as we open up the states and try to return to what we miss so much, that normal life that we've had, we're going to have to be smart about that. And so a lot of that's going to fall on the public and the patients that we see every day and the people in our community using the tools we have to try to, minimize the chance of that happening. As we look at the virus itself, there are so many unknowns still at this point. Is there going to be a treatment? Are we going to have an immunization or a vaccine? How long are you asymptomatic with this virus, which presents huge problems with how do we screen people? How do we figure out who is who? I often describe to my patients, it's like being in a zombie movie, but the zombies are invisible and you don't know where they are. So it's kind of a hard thing it seems obvious, it's kind of hard to get your head around. It would be for me if I wasn't dealing with it every day. So we go to the tool chest, and what do we use to try to stay as safe as we can as we go forward? I think that, like I said, they're pretty low-tech tools, right? Social isolation is not real fancy, smancy, high-tech, but it has been very effective. And although it's really hard to do, we're still going to have to work really diligently to maintain distancing, try to limit our large group gatherings, and I think that speaks for itself in the last few months, or last few weeks, I'll say. The other is hand washing. It's hard to get excited about hand washing, but hey, that has been incredibly effective, and there's more than enough information on the internet with that, but I'll just repeat that washing hands, we need to do that for 20 seconds. I hear people talk about singing happy birthday twice. I don't want to do that all day long. You can pick your own song, but 20 seconds, good hand washing. Doesn't have to be with soap. Ideally it is. If your hands are visibly soiled, you want to use some type of alcohol-based hand wash. I think the CDC says 60% based alcohol-based, shall I say. So hand washing, can't overemphasize social distancing, and also disinfecting and cleaning home surfaces. Again, nothing high tech. The other thing that you see now more in public, and I think people are getting more comfortable with, is wearing a mask. And this is sort of what I wanted to hit on and got me volunteered for this little topic today, is that as I see patients come in with a mask, I watch them in public. A lot of people have masks. The CDC makes a point to remind people that they don't necessarily need a medical mask. It's real important to realize that the mask, it's really not about you. It's about them. It's about the people across the aisle from you. There's a large period of time, or at least we think there is, where people do not realize they have an infection. So you have the potential to be a one-man wrecking crew if you go into a public place and do not practice the social distancing. So that we know that that mask on a person is really about protecting that other person. And we say, well, I feel fine, it's not a problem, but we really do not have the ability to know whether we have this virus or not. And that really makes it a challenge. So I just remind people that when you're wearing this mask, whether it's cloth, whether it's a scarf, you really have the potential to help that other person that might be more vulnerable than you and might have some underlying health problems that could get them in trouble. So it's really a different process of thinking about that other person. It's easy to forget that when we're consumed with what this virus can mean to each individual. In addition to that, wearing that mask, it's really important. We all have to wear those masks. Even in the healthcare system, we're wearing the same mask for up to a week at a time, as long as it's not soiled, because there's a limit to the supply of protective equipment right now, as we all see on TV and in the news. So that mask is dirty. And so I think the take-home point for me when I see people wearing the mask around is it's really important for you to pretend that this mask is dirty at all times. So when I'm sitting with a patient or when I'm in my office and I'm doing something like this, I don't have to worry about my mask. When I get ready to go downstairs to see a patient, I put my mask on. And this is a clean mask, by the way, just to not so I don't get in trouble from my colleagues. I put the mask on and I immediately wash my hands, because if I've used this mask before, it theoretically has contaminants on it. When I see patients, I come back in the door, I sit down, I'm ready to do some paperwork. I take my mask off and I put it in a place that's not going to contaminate my desk. Again, this is a clean mask. And I immediately wash my hands, because I'm going to be on my keyboard. I'm going to be doing something in my kitchen at home if you're wearing a mask to the grocery store. So if possible, literally going to the grocery store, as I've told a dozen patients this week, I put on my mask that I have in my vehicle, I do my grocery shopping, and then I come back out immediately. When I take my mask off, I wash my hands so I don't contaminate my vehicle. So those things seem logical, but I find them hard to remember. So the rule that I live by is I just remind myself my mask is always dirty, and if I touch it, I have to wash my hands. Along those lines, I've had people that are wearing gloves, and you'll notice you don't see a lot of recommendations to wear gloves, because I think it gives people a false sense of security. And so remember that if you've got on gloves or you don't have gloves, once you touch something dirty, it's dirty. It still needs to be washed off. So I find that people get a false sense of security with gloves, and they touch something and they're wearing those same gloves all day long and just contaminating everything. So I really think it's probably easier, and I notice the CDC doesn't recommend wearing gloves. I'm telling patients the same thing. I think it's better to practice the hand hygiene that we've talked about earlier. And so, not high-tech tools, but those are the tools we have, and I just wanted to make sure that we are using those tools appropriately as we move forward, and somebody smarter than me can figure out some of these other answers about immunizations and accurate testing, and comes up with protocols that hopefully are going to keep us safe moving forward. The last thing I just remind people, I think if I pick 2 rules to live by right now going forward, it would be pretend like you have the virus. And if you pretend like you have the virus, it really solves everything when you start thinking about what do I need to do? What's the right thing to do in the moment? If I have the virus, I need to wash my hands. I need to have a mask on. I need to be staying away from these people that might be vulnerable, and then pretending my mask is dirty all the time. And I think that's simple, but I think it can make a big difference for folks moving forward. That's my story.
Well, I so appreciate what you're saying, Dr. Royer. I hear a lot of focus on the mindset. How do I think about that other person when I'm out in public and consider keeping them safe? How do I make sure that I think that I am contagious at all times, or perhaps that other person? And then when I hear you discussing the the hand washing and the mask wearing, I think about a process. How can I create and train a habit? Like much like when we get in the car and we click the safety seatbelt, right? Like that took some mental time, but now if I get in the car and that seatbelt's not on, I feel like something's missing. So once we train ourselves, we'll get there.
Absolutely.
Hopefully.
Absolutely. I think we have an advantage because I do it all day, every day. So I've almost, give me another 3 years, I'll be trained. Who knows?
That's
But
right.
but it is hard, and routine is really important. So the more we can simplify so that we don't have to think all the time, I think the better chance we have of success.
Well, thank you so very much for being with us today. We greatly appreciate you and what you're doing, being out there on the front lines and the insights you bring. We also want to thank Wildflower Media for their technical and creative support in helping us to put this program together, as well as the Pisgah Health Foundation, their staff, their board, and the Physicians Roundtable, and so many others in this community who are doing so much to keep us safe. So everyone, let's practice washing those hands. Let's not touch our faces, and let's all stay well. Thank you.